Welcome back to the Sports Medicine Orthopod. My name is Anthony Yu, and I'm joined by my good friend, infectious disease expert, Dr. Rishi Desai, to make sense of the vaccine hesitation we have witnessed in a handful of NBA players over the course of this last week. We are, of course, talking about Andrew Wiggins, Kyrie Irving, Bradley Beal, who earlier this week confirmed that they are not vaccinated against COVID-19. And this is particularly important for Wiggins and Irving, who play in San Francisco and New York, cities with vaccine mandates, which will apply to those who work in large venues such as Chase and Barclays Center. Rishi, great to see you. How are you doing?
I'm doing well. Thanks for having me talk with you about this stuff. It's very, very relevant and timely.
Yeah, and we know you're a big NBA fan, as am I, and so I'm sure you've been following these headlines. What were you thinking as these media day interviews were being conducted and these handful of players, like I mentioned, were coming out to question vaccines, say it's private information, so on and so forth?
Yeah, it's a good question, and maybe even two separate ones, like whether someone's vaccine status, a public figure, whether their vaccine status ought to be public or private. That's a good question. I'm not sure I have a solid answer on that. I think then the other questions are like their general stance on vaccines, right? And then right now, I mean, we're at a stage where we're calling it the pandemic of the unvaccinated, right? Like that's a phrase,
Right.
and people recognize that it's like two different worlds right now. There's what it's like if you're vaccinated, what it's like if you're unvaccinated. Certainly with families where it's mixed, your kids may not be vaccinated and adults may be. You've got those two worlds colliding. You got to figure out how to manage that. But yeah, when I was watching them talk about it, it echoed a lot of stuff we're seeing nationally. The NBA is not immune from the national dialogue, and they're voicing things that people across society are talking about.
Yeah, absolutely. And we are not in the minds of Andrew Wiggins or Kyrie Irving or Bradley Beal, but I think as doctors, we should share a little information that there is some background to the Black community's mistrust of medicine. We see a lot of people on social media attacking these guys. What are they thinking, whatnot? And it's not a secret. And we are not Black men, but as doctors, part of our medical training is to understand the history and why certain ethnic or racial groups might feel one way or another about medicine in general. And the Black community has suffered inexcusable atrocities at the hand of the medical community. And it's just a fact. There is a mistrust in that community regarding this. Now, again, we don't know if that's what's driving Andrew Wiggins or Kyrie Irving, but we can look at the vaccination rates across our African-American population. And by the way, Andrew Wiggins is Canadian. He's not African-American. But all the same, we can look at sort of the vaccination rates across our various ethnic groups. And it does tend to be lower in African-American groups. Is that correct?
Yeah, absolutely. I mean, that's true of so many different health outcomes, is that a lot of times if you score people based on their ethnicity and see how they do with a certain health outcome, almost consistently, Black men and women will be lowest or near the bottom. Indigenous populations also near the bottom. And so there is, as you mentioned, a history around that, with research studies that would be conducted, where they didn't tell Black community members that they were going to infect them with the disease, and then infected
Right.
them with the disease. I mean, it sounds crazy as I'm saying this out loud, but these things actually happened, historically, and even today. If you look at how Black kids, I mean, forget adults just for a moment, Black kids coming in with pain get treated differently than white kids that come in with pain. They don't get believed as often. And so, I mean, just wrapping your head around that seems kind of shocking that people would do this. And honestly, it's not like it's done for the large part. It's not done willfully. It's done because people have these biases that are cooked into their heads, and they think, oh, maybe this child doesn't really need it, or maybe this kid is kind of exaggerating, or whatever it is. But at the end of the day, it's not equal. It's not equal, and therefore, a lot of Black men in this case can be distrustful of what advice they're getting from doctors, nurses, etc. And it plays out in kind of new and interesting ways. And this is one of the ways that it plays out, like mistrust of vaccines as a result, maybe.
Yeah, and so as somebody who is an expert in this field, you have a lot more knowledge than the layperson, even me as an orthopedic surgeon, about vaccine development, which historically has been a very arduous and long process. I remember in medical school thinking, wow, this is just way too long. And so there is that argument out there that this came out at lightning speed in comparison. From where you sit in your chair, is there validity to that?
Yeah, I mean, look, before COVID vaccine, think about world records. The world record for making a vaccine was about 4 years prior to this one. Okay, 4 years. Now, let's say you do it in a quarter of that time, a year. That's amazing. Like 4 times faster. That almost seems too fast. A lot of folks are like, oh, it's too fast. Did they do it the right way? Did they have all the safety checks? Now think about, you and I grew up in a similar era, and I remember like dialing into a modem. Think about how long it took to get to a website, right?
Sure.
My phone does it probably 100 times faster, right? Like no one questions their cell phone, and no one's questioning Apple and saying like, it seems too fast. Is it really done the right way? No one says that, right? Like things get faster, Anthony. Things get quicker. We're like advancing society across all fields. So you know what? Guess what? Biomedical research is happening at a faster pace today because we have technologies we didn't have a decade ago or 20 years ago. And in every other facet of our life, no one's questioning that. And all of a sudden when it comes to this, they're like, oh, wait a second, too fast. Let me question that. Now, I will say this isn't like we actually dreamt up mRNA. Like we learned about mRNA in med school. It existed, and we knew about this stuff. And the technology that underlies the current vaccines, it's been around for a long time. It's been around for years. And so it's not like they just made this technology, cobbled it together, and threw it out there into the world. It's been around for a long time. And so, but people don't know that, right? Like all they hear is like, oh, we had COVID and now we have a vaccine. And then the narrative kind of gets spun out of like, oh, it's too fast, too fast. And so I think if you really take a moment to step back and think about our general speed of technology, and then also the fact that this has been around for actually years, then it doesn't seem as shocking, I would say, but more like, wow, humanity actually got their stuff together and pull this off. That's amazing,
Yeah, you're reminding me of my 2 and 4-year-old daughter, who we just took a long road trip, and they've got an iPad with literally anything they want to watch on it at a touch, snap of a finger, touch of a finger. And I just want to say, do you know what we had when I was growing up? We had I Spy for 8 hours, and naming the colors of the cars that come by.
Things have changed.
Technology has come a long way.
Yeah, totally. And like we're also working globally. Like it was sequenced. In China, that sequence came over in a minute. Like the speed of an internet connection. 20 years ago, we didn't have that. Like it wasn't like you could just like go. You might have to fly there. You might have to meet the research team on the ground. You might have to work with them for 3 weeks and then have to fly home. And there's a lot of time that went into kind of doing research that just now happens instantaneously. Sure. So yeah, I don't think the speed should be as concerning. The other half of it is that it's not like the vaccine just came out and we're putting it into the arm of the very first person. Right? Like that's not the situation either, right? Millions of people have now gotten the vaccine, and we've now got more scrutiny on this vaccine than probably any other vaccine that's come out in history within a first year. Like we've never had this much scrutiny, and so in that kind of sort of space, things that would have been missed previously are being caught and picked up on. There's a concern about blood clots. Let's dive into that really hard. And now you've got 100 research teams around the world learning about blood clots because someone has reported that as an issue. So every little thing is being scrutinized to death. And yet we're seeing that like clearly go to any hospital and the data is obvious. Like 98% of the beds are filled with people that didn't get the vaccine versus let's say 2% of the beds among the vaccinated.
Yeah, and so Bradley Beal brought that up, right? He asked a very pointed question to the media. I want to ask all these people who have vaccines, how come people are still getting COVID with the vaccine? What do you say to that?
Yeah, so it's a great question. It's an obvious question, and we've heard a version of this question before. And here's the other version that will sound familiar. I don't get the flu shot because I once got the flu shot and I got the flu anyway. It clearly does
Right.
nothing, right? So we've heard this version, like this has come up before. We hear this all the time. I'll just say this, and I'll make it personal just to kind of help paint the picture. I have a grandfather who lives in India, and he was vaccinated. My grandfather died of COVID. So he was a vaccinated man, died of COVID. How is that possible? I'll tell you how. He was very, very old. And we know in the very, very old population, it doesn't work as well. Their immune systems are just not as robust. They're not as strong and able to even mount a defense against anything, including the vaccine. So his immune system probably didn't mount as robust a response. He did get COVID and he got a large kind of dose of it. So he got kind of overwhelmed with the amount of virus in his body. And as a result, he died. Now, I will say that by and large, that's an unusual situation. And you can look at the data to point that out. But by and large, people that get vaccinated get much less sick than those that don't get vaccinated. Now, can you still get COVID? Absolutely. Can you still have some symptoms? Can you still feel a little bit lousy? Sure. Are you as likely to need a hospital? No. Are you as likely to end up dying? No. Now, can that happen like my very, very old grandfather? Sure, that can happen. Will that grab a headline or two? Probably. And so these things happen, but we have to put it in the context of like understanding the big picture. And our human brains are not great at data. We suck at it, right? Like what we're great at is stories, right? We're great at remembering the guy that had this or the woman that had that, but we're not great at data. And so that's what's happening here is that we have a population of folks, all Homo sapiens, and our minds are not programmed for big data. Like we're programmed at the end of the day for hunting, gathering, grabbing food, running the OR. Like that's what we're good at. But we're not good at gathering data. Computers are good at that. But we're not. And so then we keep kind of tripping over ourselves with large data sets and understanding them, comprehending them. And so that's why I think, you get led astray by this stuff.
Yeah, absolutely. I read an article by David Aldridge who gave a great analogy based on this Bradley Beal question to seatbelt wearing. Can you still get in a car accident and injure yourself while wearing a seatbelt? Sure. But the risk of catastrophic damages goes down substantially. We all know that. Same reason why we put helmets on our kids when they go ride their bikes, right? Can they still fall and scrape their knees? Absolutely. But are they going to suffer a catastrophic head injury with that helmet on? Probably not.
Totally. Yeah, exactly. And like taking that risk personally, like would I want to get on the road if I knew that everybody else on the freeway driving 65 miles per hour was completely drunk? Would I get on the road? No. Would I get on the road if I thought everyone else is sober? Sure. Can I still get in an accident? Yeah, absolutely. It's still possible. People get in accidents every day. But if everyone else is drunk, I know in my head, like, wow, that's going to be a crazy day on the freeway. I don't want any part of that. So, you can kind of play out the numbers with like exactly what you're saying, analogies like seatbelts, helmets, alcohol. Like we know these things drive up the chances of a bad outcome. And the vaccine drives down the chance of a bad outcome, just like seatbelts and helmets do.
Yeah. While we're on this talk of kind of misconceptions, things that are out there, urban legends, the Rolling Stone reported that Kyrie Irving has been following and liking Instagram posts from conspiracy theorists who claims that secret societies are implanting vaccines in a plot to connect Black people to a master computer for a plan of Satan. This is reported from the LA Times, so I'm taking this from them. This theory has reportedly been spread across the NBA, as well as misinformation such as the microchip, hypothesis. I think we've all heard that there's microchips so the government can track you. You're the expert. Is there any truth to any of this?
Oh my gosh. It's so challenging, right? Like when something is so out there, you're almost like, does talking about it even make sense? Like, no, there's no truth to that. And like for me personally, I'm like, I've worked inside of government agencies, right? Do I even believe that government agencies are capable? Like let's say they even wanted to do it. Like, are they even capable of like executing that? No, absolutely not. Like, have you walked into a government agency recently and thought to yourself, like, wow, this is a team of highly skilled operatives. Like, they could pull off? No one thinks that, right? And so, and if you even like want to entertain this stuff, like, go to the DMV, right? Lovely individual people, but as a team, they're not capable of executing these things. No government agency is. And so I would just on that grounds alone say, like, there's no chance of it. And then, of course, like, you have to get down to, like, but where's this coming from? And it's coming from, I think, the need that a lot of people have to be in the know about something bigger than themselves. Like, hey, there's something big happening out there. I know about it, and I want to let others know about it. And on some level, that's a good place. It's a good place to be like, I want to be part of something big. That makes sense, right? And I want to help other people know about it. I want them to be kind of bought in so that they don't get taken advantage of. Totally makes sense. Now, if you want to avoid getting taken advantage of, I would suggest you direct your effort towards, like, shutting down lottery systems, shutting down payday loan systems. Like, there are all these, like, corporate entities that are predatory in the way that you're describing, right, that really exist, right? There truly are, like, predatory payday loan places, lottery systems, bingo clubs, like, truly predatory. And you should help avert people from getting sucked up in that, you know? But no, I don't think the microchip stuff is on that list.
That's an interesting point. You know, I hadn't thought about that. You know, one thing I've thought about is, in not these NBA players, but just in general, those who are anti-vax or hesitant for the vaccine, we'll just call it. I think a lot of it is one of the great things about the American spirit, and that is nobody's going to tell me what to do. You know, and that's, you know, we're here in this country partly because of that kind of spirit, right? Like, King George says, I'm gonna have to pay how much tax on the sea? No. We got something for you, King George. Like, and now we have this beautiful musical. Lin-Manuel Miranda is gonna be my future best friend. And, you know, we know the history on that. Actually, interestingly enough, today the New York Times, they pointed out that George Washington, in order to keep his army safe, secretly vaccinated everybody with smallpox. And that was not an option. And that has actually been listed as one of the key strategic decisions to winning the Revolutionary War. So there you go. 2 pieces of history in one, guys. And so, you know, this is not new. And they even admitted in this, or not admitted, but reported in this New York Times article, that vaccine hesitancy is not new. I mean, even back to the founding fathers, we're talking, this has been the case. But, you know, we just want to shed light on what's going on now, because this is in our lifetimes, and this is coming so fast at us in a time, a modern age, where we're not used to this kind of rapid change from a healthcare standpoint, staring down the barrel of a deadly disease like COVID, right?
Yeah, it's really interesting. Like, and I love that you brought up the vaccination of the army as being a critical reason why it kind of turned the war. There has been a long-standing fear of government overreach, and that, I think, is a big part of what you're describing in so many ways. Interestingly, and kind of ironically to me, there's almost like not enough fear to me of corporate overreach, right? Like, like in black and white ink, over 15 pages in a terms of service that you'll sign, they'll tell you all about how they're going to steal your data, right? And we'll say, yeah, that's cool, because, you know, I like social media, so click. And, like, you won't read it, you won't think about it, you won't, like, post or tweet to your friends about it. Like, it's just not a big deal. You're like, that's just how it goes, because it's a corporate entity. And then the government says, hey, we've got this vaccine. We're going to publish all the data. We're going to try to be as transparent as we can within the bounds of, like, what we can do to the level of our competency. We'll do our best. And we're like, oh no, there's got to be a microchip in there. There's got to be something. So it's really interesting to me that I think we're in this era where historically the powers to be were all government entities, right? And so that's how you feared. And now, like, in many ways, it's the big 5, like Google, Amazon, Facebook, Apple. I mean, these are the entities that own everything that's in the cloud, literally everything about me and, like, where I am positionally, you know, around the map. They know all of my communications, you know, and it's not like they have to get it. I literally said, yeah, here it is on a silver platter. And so it's just
Yeah,
interesting to
exactly.
me that the same people that are so worried about government overreach are so docile when it comes to, corporate overreach,
Yeah, absolutely. Yeah, every time I'm at Costco, which is multiple times a week because it's the greatest store ever, they know exactly where I am. And you know what? That's totally fine. I'm at Costco again, guys. I love it.
Yeah. Right.
Um, I wanted to get into, and this is, again, sort of a delicate subject, and that is the party line response, at least from these three players, is this is private information. I'm beholden to myself and my family. It's none of your business, media. Leave me alone. And to some degree, I agree with that. It so happens they are in a profession that is very public. Nothing can escape the media's attention, especially this. And so, I wanted to get your thoughts on that and sort of follow-up question before you answer that question. Um, is there a moral responsibility to explain yourself? Because as of now, we don't really have good explanations as to the reasoning here. Do you have an ethical obligation to explain yourself? And why I say that is, we are not African American men, we are not NBA players, but we work in hospital systems that have vaccine mandates. So there are analogous situations here with large teams. Like I have orthopedic surgery partners, I have PAs, I have medical assistants, I have nurses. I'm with these people every day for long extended period of times. All of us are expected to get a vaccine. If one person doesn't, do they owe me an explanation as to why? And I would contend yes, because you are now not only putting yourself at risk, but me and my kids I go home to, my wife. So I wanted to throw it to you and see what you think of that.
Yeah, it's a wonderful question, and I think that maybe we can look at a couple of different spaces and tease this out a bit. So, like, let's look at public officials. So we vote for them. They, at the end of the day, are our representatives, but their paycheck comes from the taxpayers, dollars. And at the moment, they don't have to necessarily disclose whether they're vaccinated or not. In fact, many public officials have said it's my business. And to my knowledge, there's no pushback on that, in the sense that there's no legal framework whereby they have to declare their vaccine status. Similarly, it's not like we have any sort of standing around asking for a brain MRI from our presidents on any sort of basis. Like, what if we find out that, like, our current president or past presidents have had a lesion in their brain, right? Like, would that change my thinking on them? Probably, right? Like, if I see a big tumor, I'm like, whoa, that's interesting. That changes my vote,
Yeah.
right? So, but we don't ask for that. We don't require that. What about people that are appointed to the Supreme Court? They're sometimes lifetime appointments. What if they had a brain lesion? Would that, like, and yet these are public offices, right? Like, and so we don't have that requirement necessarily of those folks. Now, so from that standpoint, I would say probably for a private industry, the NBA is a private corporation. Yes, people sign up to go to the games, but that's engaging with a private entity. In that private world, probably the NBA ought to make those rules, and it probably would stand to reason that they might want to require more transparency to ease the concerns of fans, right? Like, that would make sense. But again, if they choose not to, I would say that that's their business. And then with that, it would follow up that a player like Andrew Wiggins or Bradley Beal or Kyrie may not need to disclose that. That might be their prerogative. But that would be, I think, for the NBA to decide. With what you're describing with, let's say, the healthcare setting, it's a little different. It's kind of between the two, right? So there's a private component, a public component, because you do serve Medicare patients. So there's a public function there. The hospital likely gets money from public dollars in some way, shape, or form. So there's some public responsibility. There's also private responsibility. So there, I think it is somewhat in between. And so if you're in that space and you're working there, do you have a right to know who you're working around and what threat you're putting yourselves at? And I think that that's something that we are currently debating as a society. I personally do agree with you. I think, yes, absolutely. I think in public spaces where there's an employee that's getting paid through public dollars, information about a public health threat like COVID should be declared. Now, do I think that gives you the right to know about someone's hepatitis B vaccine?
Yeah.
Maybe not, because there's no Hep B pandemic. And so
Right.
in that sense, like, I think knowing about someone's vaccine status is relevant only in the setting of a pandemic. But let's say the COVID pandemic is over, then do you get to know people's vaccine status? I would say probably not, because then the burden is on their private health, let's say with Hep B, versus the public chance that they would actually give you or transmit Hep B to you. Maybe Hep A is a better example, because that's more likely to get passed from one person to another in a healthcare setting. So that's what I would say. I would say that, yes, I agree with you, Anthony. You should know, in the context of a pandemic, when you're serving the public good, what risk you're putting yourselves at and your family at. But if that pandemic was to pass, then I don't think that you need to necessarily know someone's vaccine status.
Yeah, absolutely. And I think in these cases, I don't think the 30 reporters who were in the press conference with Andrew Wiggins necessarily need to know, though I think you can make that same philosophical argument that those 30 reporters were all vaccinated and he's not. And so therefore there's a theoretic risk that Andrew Wiggins is exposing them to. And so, using my train of logic, maybe they do have a right to know. But, those other 12, 13 guys in the locker room, coaching staff, training staff who are with an unvaccinated player when everybody else is, they're at risk. And that's, we all know, I think, the financial implications. We mentioned it before for Warriors, Knicks, anybody playing in those San Francisco or New York markets who has an arena within the city limits. The mandate is there. And if they're disqualified from playing home games, if they're not vaccinated. And so there's obviously huge financial implications. The NBA spokesman, Mike Bass, just put out an announcement yesterday. And he did actually say that the NBA proposed a vaccine mandate, but the NBA Players Association rejected it. And where was I going with this? So that, there's huge financial implications, but we're kind of talking about things beyond just money, right? And that is, what kind of risk are you imposing on those around you when all others are vaccinated and you are not?
Yeah, so you're definitely spot on. And you have to keep in mind, Andrew Wiggins is not also. I mean, you referred to him and kind of reminded us that he's an African Canadian man, African American man, if you consider the fact that he might identify that way now that he's playing here. Regardless, he's not the average African American man, like in a few distinct ways, right? He has better access to healthcare in all likelihood. Mm-hmm. He has a training staff around him that will, at the slightest symptom, will jump on that and isolate him. He's getting tested on a regular basis in a way that most African American men in the community, frankly, most men in the community, including myself and yourself, we're not getting tested. Maybe you are at the same frequency that he's getting tested at, right? So there are heightened measures that actually protect Andrew while he's making this choice for himself, right? Mm-hmm. And so, given that, it's a little bit, it's important to notice that, because the listener might hear, "Oh, Andrew's not getting vaccinated, I don't need to get vaccinated." It's like, no, right. You're not Andrew Wiggins. Like, you don't have a coaching staff and a physical therapy team and a medical team revolving around you like you're the sun and their planets 24 hours a day, making sure that you're safe. Right. You're on your own, man. And so if that's your life situation, you ought to be weighing factors differently than Andrew is weighing them. I still think Andrew would benefit from vaccine, clearly, but he is at slightly lower risk, given all those other factors, than the average person listening to Andrew's story.
Right. Yeah. And, actually the NBA and the WNBA in particular should really actually be applauded, because their vaccination rates far outpace what we see in the country. NBA, as of yesterday, 90%, WNBA, 99%, just, absolutely great. So for the vast majority of players, they are doing with what we agree with, that they should be vaccinated. And some have come out to support it, to try to spread the message. Drew Holiday, Karl Anthony Towns, anybody who knows his family history, it's just tragic how many people have been affected by COVID-19. Kareem Abdul-Jabbar just came out. Steph Curry has made some very encouraging comments regarding the Andrew Wiggins situation, hopeful that he can get the right information, the information that makes the most sense and is most accurate. And then Damian Lillard, who I love, Oakland native, just like me, gave a great media day interview where he said, the decision was easy for him. He could get his whole family vaccinated. He could take care of his whole family, his inner circle, who he's with all the time. That's issue number one for him. And then also, and Rishi, you can attest to this, certain professions, you got to get shots all the time. Playing basketball was one for him. And, certainly for like high school sports, I had to do that as well. And to be a doctor, you got to get a lot of shots every step of the road. College, medical school, residency, any hospital you work at, you're getting shots. And you and I know what those shots are for. Damian Lillard basically said, I have no idea. I can tell you one thing about those vaccinations or really anything about them, but he did it because that was the right thing to do. And he needed it to do the thing he loved, which is play basketball. We needed to operate and perform our duties in the hospitals. And I certainly couldn't tell you, like, what are these vaccines composed of, and so I just wanted to throw that to you, like, why the difference here? Vaccines are not new. We have to get them no matter where you are in life in the United States for various things. So what's driving the difference here?
Yeah, I think what's driving it is that we've entered into a place where we are calling into question the knowledge of the expert and really challenging, do experts really know what they're talking about, right? Like, I turn on my car, I don't have to understand how the car works. I just need to know how to sit and drive it. Like, that part of it I need to know, but I don't need to know how it works because I trust the mechanic to do their job when it's broken, right?
Sure.
I go to a red light and I pause there. I don't need to know how the electrical signal works to like coordinate our 50 cars from passing through properly and not hitting each other. I just need to know when it's red, I stop, when it's green, I go, right? Like, we don't need to know everyone else's job. And just think about like how crazy that would be if 7.5 billion of us had to know every intimate part of everyone else's job. Like, we would be paralyzed, right?
Right.
And so that's not how we function. We've never functioned that way. And all of a sudden now there's this complex like chain of people. Hundreds of people have gone into making a single shot, thousands, right? And you're calling that into question and saying like, oh, what's in it? Well, do you really want to know about 1,000 jobs? Like, if that's what you're interested in doing, you'll be on this goose chase forever, right? Like, at some point you have to say, okay, I trust that 95% of the doctors know what they're talking about. And 95% of the doctors out there have all like vocally endorsed the COVID vaccine. So I trust that, right? And I say 95, maybe it's 99, maybe it's 99.9. I don't know the number, but the vast majority. And so you just have to, at some point, like, pull it back and be like, all right, I trust them to do their job. And we've always been doing that. Like, it's not like a lot of these folks that are coming out and saying, I don't trust COVID, had any problem with Hep A, Hep B, rotavirus, like all these other vaccines that their kids may have gotten, they may have gotten. And I bet they didn't even know how long it took to make that vaccine. Like, they didn't even dig even peripherally or do a Google search or anything, right? And yet they were fine with it, because up until about 2-3 years ago, we've always been fine with this. And it just, in the last couple of years, has become a thing because politically, all of this stuff has been called into question. Experts themselves have been called into question. And so it's been turned into a political football, but it never used to be that way.
Yeah. Well, the debate rages on. We'll see what happens with these guys, and they're not alone. There are a few others, Jonathan Isaac, who NBA players who've come out with skepticism about the vaccines. The one thing that I kept hearing is that these are my beliefs. I'm entitled to them. But one thing I would say, and tell me if you agree, is that not all beliefs are correct. Some people believe that they can drive drunk. It doesn't make it right.
Yeah, I think that's exactly right. Like, my high school teacher once told me that your rights start with your fist and end with someone else's nose. And so, like, you can whip your fists around as much as you want, but the moment you touch someone or hit someone, your rights stop at that point, because then their rights take over. And I think similarly with COVID, we're not talking about whether or not you want a medication to get better with COVID. That might be a different conversation, like whether you want a certain treatment or not, because that really truly is affecting your body. But when you get COVID, like it or not, your body gets hijacked and you turn into a virus factory. And when you become a virus factory, you're putting everyone around you at risk. And that's why this is so contentious, right? This is not just about your health. It's about the fact that you're turning into a virus factory, and society doesn't need any more virus factories right now.
Yeah, absolutely. All right, Rishi, great to see you. Thanks so much for joining us again. We hope you enjoyed the show. Please subscribe, please watch, please like, and we'll see you next time. Thanks very much.
Hey folks, thanks for tuning in. If you like the show, please subscribe, like, and share. And we'd love to hear from you. If you have a question about today's show, or you, a loved one, or maybe your favorite athlete has sustained a sports medicine injury that you would like to know more about, please reach out to us on Twitter, Instagram, Facebook, or email. And stay tuned for more exciting content from the Sports Medicine Orthopod. Thanks again.